This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, this is Dr. Deepak Megur. Welcome to yet another case of a mature intermittent cataract in a 75-year-old gentleman. The slit examination shows that the chamber is slightly shallow. The antechamber depth on biometry is 2.3 mm. There seems to be an underlying nucleus which is relatively dense, and let's see how things turn out. Posterior subtenance anesthesia is given. 1.5 ml of lignocaine is injected in the infero-medial quadrant. As the initial steps are being made, let me go through the plan which I have. The challenges in this case obviously would be the rhexis and then the nucleus management. I am expecting a slightly denser nucleus, so the plan is to make at least a 5 mm rhexis and then decide upon the choice of nucleus division technique. So I'm contemplating to consider doing stop and chop technique in this eye, and let me see how things turn out. The rhexis is done. I don't usually do hydrodissection. Time to introduce the phaco probe. Once the superficial epinucleus in the cortex is taken care of, the underlying brown nucleus is laid bare. So in this case, I've decided to perform the stop and chop technique. So the settings are changed to the sculpt mode. We've set the power to 90% continuous torsional with a very low flow rate and vacuum. The sculpting is begun. The tip moves from the proximal edge of the rhexis margin to the distal edge of the rhexis margin in a straight line. Please note that my second instrument is always supporting the nucleus. This adds stability to the nucleus when we're performing this sculpting maneuver. Aim is to create a trench which is about 60 to 70% depth, and once I feel that the adequate depth is reached, I'm going to place the two instruments, that's the phaco probe and my long chopper in my left hand, trying to keep them deep into the trench and then do a lateral separation. I don't have to use any excessive force, just a little bit of nudge on either sides and either walls of the trench. This will result in an initial crack. It is not running full thickness, but not an issue at all. The nucleus is rotated, and again the two instruments are placed at the bottom of the trench. As the two instruments are performing lateral separation, please note at the second attempt I am placing the chopper way down, deep near the posterior plate, and then the lateral separation maneuver is done. So this ensures that the full thickness crack can be achieved with the least amount of physical force. So positioning the second instrument as deep as possible is the secret to break the posterior plate effortlessly. So time to perform the vertical chop in these two heminuclei. The settings are changed to the chop mode, wherein I'm going to use the burst mode in longitudinal energy. The tip is buried and then the chopper goes down vertically, and then there's a lateral separation. The first piece is generated. Time for the second chop. Please note the position of the tip. The entire exposed tip is buried into the substance of the nucleus. This ensures that we have got a firm grip on this dense nucleus, and then the sharp chopper goes down vertically, and then the lateral separation maneuvers are being done. Time to divide the second heminucleus. The fragments are rotated. The second heminucleus is brought in line of action. The tip is buried into the substance of the nucleus. The sharp chopper goes down vertically, and then there's a lateral separation maneuver. Often there would be disengagement of the tip with the fragment. Time to re-engage and then do the lateral separation maneuver. Time to perform the last chop. As the lateral separation maneuvers are being done, please note the position of the chopper which is there in my left hand. It's going right deep near the posterior plate, and then the lateral separation maneuvers are being done. This helps us to get the desired effect of breaking the posterior plate using very little physical force. Now we have got 6 smaller fragments and time to consume them. Settings are changed to the quadrant removal mode, and the principle of this setting is we want to use a very efficient cutting energy, and holding is not an important function of this stage of the surgery. So torsional mode is on, and we set a power of about 50 to 60 power, and obviously the flow rate and the vacuum are going to be slightly higher. So each of these fragments are gently pulled out of the bag and emulsified at the level of the rhexis margin. Care is taken to minimize the turbulence by controlling the energy delivery with the foot. So all the 3 fragments are emulsified. Now, before I embark on emulsifying the remaining fragments, I want to replenish the chamber with some OVD so that it can safeguard or minimize the endothelial trauma. So time to emulsify the last few fragments. Again, I'm trying to be as slow as possible, trying to minimize the use of energy and ensuring that the lens chatter is kept to the minimum. The second instrument is kept slightly on top of the phaco tip, which aids in minimizing some of the fragments going and hitting the cornea. The last small piece which is stuck near the side port is aspirated out. Time to do the cortex aspiration. Now, before doing cortex aspiration, typically I just go in and blow the posterior capsule or polish the posterior capsule with a jet of BSS. This also loosens some of the cortical fibers which are sticking onto the posterior capsule. So I prefer to use the bimanual INA, and in a matter of a couple of minutes the cortex is taken care of and time to place in the lens. The OVD is placed into the bag. The planned foldable single piece hydrophobic lens is gently maneuvered into the bag and aligned. The OVD both in front of the lens and behind the lens is irrigated out. Side ports are hydrated. That's it, the case is done. So this was a demonstration of a stop and chop technique in a mature cataract which had a slightly denser nucleus. Thank you for watching and hope you found this helpful.